Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The feature presentation is coronary artery calcium score and heart disease. What is the relationship between coronary calcium and heart disease? Can we identify who is at risk, who needs treatment, and what is the prognosis based on the coronary calcium score? Coronary calcium testing is done using a CAT scan. It is a very simple, non invasive test. There's nothing injected into your body. You just go through the CAT scan and it looks for calcium in your coronary arteries. And here is an example of a heart scan of coronary calcium score, and the score is 0 because there is no evidence of any speck of calcium along the coronary arteries of the heart. And here is an example of a patient with significant calcification of various branches of the coronary arteries, suggesting significant triple vessel coronary artery disease or heart disease with a calcium score of 1200. So, what is the prognosis if a person has a calcium score of 100 versus somebody who has a calcium score of, say, 400, 800, or 1200? And how do you treat these patients based upon the coronary calcium score? And when you do an angiogram on these patients who do have coronary artery calcium, you can see this is again a CAT scan showing the coronary angiograms. You can see the outline of the arteries along with some white specks here which represent the calcium deposited inside the arterial walls. So depending upon the amount of calcium in the coronary arteries, it determines how significant the coronary artery disease is, and it also helps us to predict the prognosis of these patients over a period of 5, 10, 15 years, and also helps us to see who needs proper treatment or aggressive treatment. So let us dwell more into this featured topic. Calcium score and heart disease. We already showed a relationship between the calcium and the coronary artery disease. It tells us about the extent of the coronary artery disease. As I said, if you're just having a small speck of coronary calcium, it may not be significant. We look at as what number really makes a difference. Again, based on the coronary calcium score, we can predict the prognosis of these patients. We'll also determine who will benefit from treatment and who needs statins based on a coronary calcium score. We're going to answer that. And can I decrease my coronary calcium score? That's a very important question which we will cover towards the end of this presentation. All right, let us begin with just doing this simple coronary calcium test, which I said is done using a CT scanner. And here is an example of the lining of the arteries in multiple locations showing the calcium, and the actual calcium score is like 752, which is exceedingly high. And here you can see heavy calcification in the coronary arteries, showing that there is a significant amount of calcium, and the calcium score is 965. This carries a worse prognosis compared to a person with a calcium score of, say, like 200 or 400. So that is an important distinction to make. And I already showed you about the correlation between the calcium on a simple CT scan with the contrast enhanced coronary angiograms showing calcium in various locations. So, what is the relationship between calcium and coronary artery disease? As we get older, our coronary arteries get calcified. That's just a process of aging, and it is just inevitable. However, it varies with different ethnic groups. As you can see, it is lower in women compared to men in all different ethnic groups. Chinese have sort of the lowest degree of calcium deposition in the coronary arteries, both among women and men. And the Caucasian group or the white group both women and men have a much higher incidence of calcium deposition in the coronary arteries as they age. From age 60 to 70, it goes up. From 70 to 80, it goes proportionately much higher. So the higher the amount of calcium, the higher is the incidence of coronary artery disease or multi-vessel coronary artery disease. Okay, here is another way of looking at it, and that is if the calcium score is 0 and you have no risk factors like hypertension, diabetes, or peripheral vascular disease or high cholesterol, then your risk of cardiovascular events is exceedingly small. But on the other hand, if there is a patient with multiple risk factors like hypertension, high cholesterol, diabetes, kidney problem, vascular disease, and they have a calcium score of greater than 300, their risk is almost like 50 to 60% times higher than the lowest risk population. So clearly the calcium score, just basic simple calcium score can tell us how significant the risk of cardiovascular events in the future is based upon the calcium score and the number of risk factors. All right, so here is a sort of an approach to how we deal with these patients based upon their calcium score. And the most important thing is to understand who needs treatment, who does not need treatment, and who may not benefit from any treatment based upon their calcium score. If the calcium score is 0, that is, you absolutely don't see a speck of calcium on the CT scan, they do not need any treatment, they do not need statins or any other medications. But if the calcium score is 0 to 100, of course, lifestyle modifications such as weight loss, blood pressure control, meditation, diet, exercise, all these things can help to improve your quality of life and longevity. If the calcium score is between 101 to 400, then these are the patients who are at a higher risk of having cardiovascular events, and they are the ones who need to be treated with all the risk factor modifications, lifestyle changes, and of course, possibly aspirin and statins. And of course, if the risk is greater than 20%, that is when the calcium score is greater than 400, they need to have all the lifestyle modification. Lifestyle modifications is the basic foundation of trying to stay away from heart doctors and hospitals. I mean, let me tell you, I've been in cardiology for more than 40 years. This is the fundamental thing which most people need to do. They don't follow it, but if you religiously follow it, you certainly can lead a much better quality of life. So these patients with a high risk, greater than 20% of cardiovascular events over a 10-year period, they need to be treated with aspirin along with statins, especially if they have a coronary calcium score of 400 or greater. And here is an interesting study that is MESA that involved 6,722 participants from various ethnic groups who were subjected to coronary calcium score, and based on that they followed them for 5 years to see what is the incidence of cardiovascular disease or events like heart attack or stents or bypass surgery or even mortality. If their calcium score was 0, as you can see, the risk of cardiovascular events over 5 years was less than maybe 1%. Whereas if their calcium score was greater than 300, their risk of cardiovascular events was 10% or more by the end of 5 years. This clearly shows what risk category you fall into based upon the calcium score. And here's the same study looking at who needs statins and who does not need statins. And as you can see, the blue color is people with 0 calcium score, and the orange one is with 1 to 100 and greater than 100. As you have more number of people in the 0 calcium group, they do not need statins. But if you have a significant number of people, like more than 40% in the group, they need statins. But really, those people who have zero calcium does not need statin treatment. That's the conclusion from this study. Now let's look at how do you determine what is your risk? I mean, who's going to tell you? Your doctor is supposed to tell you, but you can do that yourself. There is this website which is mesa-nhlib.org, and you can copy this and paste it, and here you come to this page where you can put in your demographics and your data, your age, your sex, coronary calcium score, ethnicity, and his risk factors. Remember, I'm talking about risk factors: diabetes, hypertension, peripheral arterial disease, high cholesterol, blood pressure. When you put all these numbers, it will give you your calculated risk of coronary artery disease. So based on your risk, whether it is 5%, 10%, or 20%, we can go back to this chart previously and we can say, like this chart, and say, okay, your risk is 10 to 20%, then you need lifestyle modifications. If the calcium score is higher, then you need to be on a medical treatment with statins and other drugs to control blood pressure and diabetes. If your risk is greater than 20%, then you need the full treatment along with lifestyle modifications. And here is a study which showed that if the calcium score is 0, then whether you give them statins or not, there is 0 statins and 0 no statins. There was no difference in the outcomes. So you have to understand, you just can't just throw in aspirin and statins on everybody because they do have side effects. Aspirin can cause bleeding. Statins can affect your liver and many other things, muscle enzymes. So you need to treat the appropriate patients. So if you can identify those people who are with a calcium score of 0, they don't need to be on statins. And here's a study showing the aspirin. When do you give aspirin to someone with a calcium score, whatever it is? If the calcium score is from aspirin prophylaxis as a primary prevention of cardiovascular events. However, if the calcium score is greater than 100, they may benefit by taking aspirin. And if their calcium score is much higher, they may also benefit by taking statins. So ladies and gentlemen, this is a quick overview of what is coronary calcium scoring, how do you get it done, and how you interpret these numbers and look at what your 10-year risk is, and based on that, see what is most appropriate treatment for you. This is presented to you as an educational piece of information. You need to consult with your specialist, especially cardiologists, to see what exactly needs to be done based upon your entire medical evaluation. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel. We have hundreds of videos on cardiovascular education for the public. You can watch them, and I will see you in the next presentation. Thank you so much.